So, Representative Phil Gingrey is he's from Georgia, and he's one of the Republicans focused on a full repeal of this law. He's also the spokesperson for the Doctors Caucus in Congress, and is a doctor himself. Dr. Gingrey, thanks for being with us. You heard the president just saying they're just not willing to rehash this debate again. Do you think Americans have the stomach to go forward in Congress and fight this battle all over again, knowing full well it's not going to go anywhere past the House? It's really sort of a symbolic thing.
Well, the Americans definitely have the stomach to fight the battle again. And I think what they understand now is since we couldn't or have not so far been able to repeal Obamacare, the number one issue now as we go forward over these next 4 months, repeal Obama. Because once we do that, then indeed, if we have a majority in the Senate, we maintain that majority in the House of Representatives, and we have the 45th President of the United States, Mitt Romney, then we can indeed repeal this bill, and we can do it by reconciliation, since it's a tax issue now, as Justice Roberts has redefined the law. Then it'll be easier, in fact, when we have the majority. We won't need to have 60 votes in the Senate. We can do it with 51. But you know
something? Reconciliation is not something we haven't seen before, and it does get a lot of people fired up and angry as well, because some people look at that as just the ultimate in politicking and really going against what the majority of people elected want to and feel like they should be doing. And I'm going to add to that, sir, and I'm going to add to that the statistics that show Americans can't stand Congress right now. The stats have you at a 79% disapproval rating and only a 17% approval rating. So there you go, talking about, you know, all the loopholes that you can enact to try to repeal Obamacare. Do you think that Americans are going to have had enough by then?
Let me tell you this. I think Americans are very, very proud of Majority Leader Eric Cantor's decision to put before the House of Representatives on a date certain, July the 11th, to once again to very forcefully say we want this law repealed, because we know that that's what the American people want. All the pundits in the world can say, well, it's dead on arrival in the Senate. Well, miracles can happen. I don't think they will under the leadership of Harry Reid, but the American people understand that we are their voice in this Congress. We will continue to be.
Okay, I'm going to take issue.
The law may not be unconstitutional,
right,
but it is un-American.
Dr. Gingrey, I'm going to take issue with what you just said when you said Americans want it repealed. I have statistics that show, if you look at the very surface, that the majority of Americans actually oppose Obamacare. 43% favor, 51% oppose. But if you go into that 51%, it's not because they support what you're saying. It's because there are 13% of them who said, we want it to go even further. We want an even more liberal version of this. So when you say that the majority of Americans oppose Obamacare, it's a little misleading.
Well, you know, we could argue those statistics all morning long.
No, you can't. It's black
well, that's
and
what
white.
you're trying to do. But let me tell you what. You look at the results on November the 7th. The Obama administration today may be celebrating, high-fiving, popping all over the place.
Sir. Let's be fair.
But I'll guarantee you we will make lemonade out of these lemons. And you'll see that, and the American people will prove it on November the 6th.
So, and here's why I ask you that might be a Herculean effort, because when you look at what Americans say matters to them most as they head to that ballot box that you're saying is going to favor your position, they don't seem to care that much about health care. It's black and white. The stats say 52% of Americans are fed up with the economy and jobs. Look third down on the list here after deficit and government spending, and only 6% of Americans are going to be that riled up about health care. That doesn't speak well to what you're saying is going to happen.
Well, you make a good point about the statistics on the economy. That is the number one issue. 40 straight months of unemployment above 8%, 13 million Americans out of work. So, yes, you're right. The jobs and the economy are the number one issue. But the health care issue is so much interrelated with that. Employers are not hiring people because if they go above 50, then, of course, the employer is penalized, fined indeed, if they don't provide not only a health insurance policy, but the one that's dictated by the federal government about this onerous law, Obamacare.
Can you help me understand something? Because I was so thrilled to have you on, not only because you're a doctor and you would know a lot more than I would know about the arcanity of this law, but also because, you know, you're the head of the caucus, the doctors' caucus. Right. You have this opinion of Obamacare, and yet the American Medical Association, the American Cancer Society, the American Academy of Pediatrics, the American Heart Association have an absolutely opposite view, saying it is great. How is it that you smart doctors can't all agree on whether Obamacare is good for Americans or bad for Americans?
Well, you know, there are about 750,000 physicians in the country. The American Medical Association maybe represents a fourth of those. I'm not denigrating the American Medical Association. We just don't agree 100% of the time. And I think the majority of the physicians across this country agree with me and the members, 21 members of the House GOP Doctors Caucus, and I'm very proud to co-chair that group. So I think we're spot on in regard to opposition to this law. What it will do to physician workforce, there'll be no doctors left in 10 or 15 years to treat our Medicare patients, our most frail,
well, then it would be
seniors.
strange that we would have, you know, those four groups and even further who agree with it and think it's a great idea if they were going to be out of work.
Well, here again, I think these organizations sometimes speak from the top down and not from the bottom up, unfortunately. Look what AARP did in the deal they cut with the White House. They supposedly, purportedly, represent 37 million seniors across this country, and 14-1 those seniors told AARP leadership, we don't want this, we're opposed to this, yet AARP 2.5 years ago met with the White House, cut a deal, and agreed to endorse it. For what reason? I think we need to connect those dots, just as we need to connect the dots and get the emails in regard to Fast and Furious.
So Congressman, wow, you did it. You went there, and I haven't got any more time. So you'll have to come back, and we'll have to talk about Fast and Furious as well.
I would be happy to.
You're a fabulous adversary, and I appreciate you coming on to talk about this, and I hope we get a chance to talk further.
Thank you very much.
Thanks, Congressman.
This is CNN.